So, first of all, we will discuss about TB. Everybody knows it is a tuberculosis. It is very common infection. In case of AIDS, it is caused by Mycobacterium tuberculosis. In case of AIDS, it is very much common. So, as we all know, there are many types of tuberculosis. It is not only present. It does not only affect lungs. It may affect skin. It may affect intestine. It may affect anywhere, like miliary TB. So, what is miliary TB? The TB from blood or from lymph node to other areas. It transfers from blood or lymph node to other areas. Okay, and there is a if it travels through lymph nodes, then it is called scrofula, and there is presence of lymphadenitis. Right. So we have to remember some important things about TB. Like first is miliary TB. Second is scrofula if it travels through lymph node. Third is POTS. In this, there is kyphosis, bending of spine, right? Then there is lupus vulgaris. It is a skin disease, so it is in skin TB. And most important is oral TB. There are formation of leproma in the tongue. So basically, T, T, T. So there is formation of tongue ulcers and secondary, primarily tongue ulcer. If secondary tuberculosis of oral, if there is a secondary oral tuberculosis, then ulceration of mucous membrane. And in case of primary, initially there are lesions on the tongue. They may transfer to palate. That means if T is in first, it is initial sign, and T at the last, it is late sign, right? So that's all we have to remember about TB. One is miliary TB, scrofula, POTS, lupus vulgaris, and oral TB. Next is scarlet fever. In case of scarlet fever, just remember the redness. All the lesions in the scarlet fever are red. So there are red color rashes, and when you place palm over the lesions, like there are red lesions on the body part. When you rub palm over it, it feels like that you are running your palm over sandpaper. So you feel like a sandpaper. Sandpaper appearance is there when we run a palm over whole of the body, right? Sandpaper like appearance, right? This is a particular symptom, particular sign you can say, right? Now you have to remember some things. So first is sandpaper like appearance. Second is the lines you can see at the crease area, like where you are going to bend your, like your knee, your elbow. So these are called crease areas. There you can see pasta lines, right? Then come to third is stomatitis, and fourth one is scarlatitis. Scarlatis. So what is this? This is basically in the over the tongue. There are two types of papillae. Piliform papillae and fungiform papillae. So you can see there is redness in these filiform and fungiform papillae. In between that, there is whitish discoloration. So you can see half redness. This is called strawberry tongue, because in the strawberry there are white patches or white spots in between the red spots. So somewhat white, somewhat red. So you can see there is ulceration, there is inflammation of filiform and fungiform papillae, and tongue looks like strawberry. So strawberry tongue. And secondary, when there is a whole red tongue, it is called raspberry tongue. In this case, you can see uniform redness over the tongue. Uniform redness over the tongue. So it is called raspberry tongue. Right? Then come to your Behçet's syndrome. What is Behçet's syndrome? Basically, the Behçet's syndrome is caused by PPLO, plasma pneumonia like organism, right? So it is called the PPLO. So we'll remember some important things only. In this case, there are oral ulcers, oral ulcers are definitely present. In oral ulcers, there may be genital ulcers or there may be eye inflammation. So they may be out of these two, only one is present with the oral ulcers, right? So the test is skin prick test, right? Or skin pathogy test, and eye, oral and eye inflammation or genital ulcers, right? Then come to your next is aphthous ulcer. So aphthous ulcers, as we all know, minor and major ulcers. So in minor ulcers, they are basically more common, right? They are more common and they are less than 1 centimeter. They are more than or equal to 1 centimeter. They're called major aphthous ulcers, right? So basically, they are smaller in size and they are larger in size, right? Larger ulcers are also called Sutton disease, or Sutton disease. You can say anything. Mikulicefte, right? Or sometimes canker sores, right? And if there is a recurrence of aphthous ulcers, if there is a recurrence of aphthous ulcers, then it is called recurrent herpetiform ulcers, but they are not herpes. They are very, very, very tiny ulcers. Just remember, recurrent herpetiform ulcers are not because of herpes virus, right? Then come to your Crohn's disease. So what is Crohn's disease? Just remember the mnemonic C. There is cobblestone appearance or recurrent aphthous ulcers H. papules of oral mucosa and N is intestine ulcers, right? The next one is Sweat syndrome. I'm just trying to give you idea about the important questions. That's it. This sweat syndrome, there are it is a basically neutrophilic disease. 5 to 10 neutrophils remains. Just remember this only. Then come to very important disease, which is syphilis. So in case of syphilis, it is of two types. It is of two types: acquired and congenital. We'll discuss about acquired first. Primary, secondary, tertiary.